Oh yeah, here we go. Practice acquisition. There are pitfalls throughout the entire process. If you want to buy a practice, this is how, folks.
Acquisition Unscripted, the truth when buying and selling a dental practice. And now your host, Michael Dincio.
All right, guys, we're back. This is Mike Dincio, another episode of Dental Acquisition Uncensored. As always, Mike Dincio, your founder of Next Level Consultants, and I have a guest. If you guys watched the part previously, I have my co-founder, my partner, my Coco. I don't know, my friend, partner. And we're continuing the conversation from last episode. So if you're just jumping on this one, stop it, start it the other episode right before this and listen to it. And we're going to continue the conversation. Right now, we're deep diving into the clinical part of due diligence. And we were picking up right where we left off. We really got into the hygiene. We got into what reports and codes and what to look at with the schedule. And we just started talking about the mindset of the buyer going into the process. And I wanted this to be a two-parter because the idea of you buying a practice, you have to be the majority. Sorry, I'm struggling to say this simply, but the reality is your success is very, very heavily weighted on your ability to produce or at least mirror the seller. Because up to this point, if you've been following the program, your CPA, your banker, everybody's looking at historical financials, historical new patient counts, historical procedure by provider reports, historical collection rates, blah, 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 historical. Then you're going to take it over. And it's really easy to try to predict what they did, but there's one factor that changes all of it. And that is you as the owner. And so today we are continuing this conversation with Miss Paula Quinn. Paula, thanks for joining me again today, not today. We just finished it and we just started over again. It's part two of this same conversation. So we don't have to introduce her again, but Paula, thanks again for being here today.
Of course. So
going on down that vein, how important is it in your mind for a dentist to have a realistic impression or I guess awareness of what they're able to do as a clinician? And I'm going to lead the witness a little bit again here. We've had many clients that maybe questioned their ability or the opposite, had many clients that were super confident about their ability. How did that impact their transition and all of that? Because we've been through a lot of transitions now, and it's been amazing, the results in this situation. So what goes through your head when I ask you that question?
Well, you're right. We have had both ends of the spectrum. And I think that, we in the first episode, we talked about procedure by code, right? So I think making sure that, when you're looking at those, do you have the ability to do the kind of dentistry that the previous owner did? And if they did one or two of them, no big deal, right? Who cares? And honestly, even if they did them, you could refer them out, or you could have somebody in your practice, but it's going to take an impact on the revenue of the practice, and you're buying at it here, right?
Mm-hmm.
So you're expecting to produce here. And
Mm-hmm.
if you all of a sudden can't do some of those procedures or half of those procedures, then obviously you're overpaying for a practice because you can't perform like that. So
well said. Yeah.
Yeah. And we've definitely had both, and I think that Some insecurities are just, until you get in there, you figure it out. But then some insecurities are insecurities, and no matter how hard you try, they're not going to change. So if you doubt your dentistry and you doubt what you can do, there's a fine line between, just needing some encouragement and really not having the skill to do it.
Yeah.
And I don't know, Michael, maybe you have something you're wanting here, but only, I guess, if you're able to crown prep.
No, I mean,
in a good way.
You were married to a dentist, and your first practice that you owned with him, you talked to me about stories about him doing stuff that maybe was questionable. I think all dentists probably.
Thank God my name has changed, or he would be really upset.
Yeah, that's right.
Yes.
I didn't even think about
some
that.
horror stories, right?
Yeah.
We all graduate and come out and have our first patient. And even though we saw patients in school, we have an instructor, and we have as many hours as we want to get that done, so looks completely different in our own practice without a mentor, without all the time in the world and the pressure of needing to produce, to match what we paid, right? To pay the bills.
Yeah. In the same vein, I'm not really looking for anything, Paula, just a good conversation around the idea of that 60% of the risk of the success of this transition, is your ability to match and produce at the same level. Because to me, the biggest risk of buying a practice is buying something and running it into the ground. And we're not talking about the business part of it. It's the same rent, the same team, the same benefits, the same utilities and loan payments. We've already all predicted your team does that for you. But you can run a practice into the ground if you cannot keep up with the pace, if you can't do some of the procedures. And looking at that schedule, you talked about it, like look at that schedule and see what they're able to do. That's speed and time, right? And then it's also looking at the actual procedures. If you can add that to the practice, or if you can't do it, then what's the offset of that revenue? If you're not a big extractor.
Yeah, like if one doctor takes an hour to do a crown and it takes you 2 hours, I mean, that's going to have an impact, right?
It is.
We had one recently, Michael. I don't know if your head went around this, but we had one who bought more of a GP practice and wants to do high-end dentistry. So, then there's that challenge of, changing that philosophy from a bread and butter to, a high-end practice.
Yeah. I think that your vision has to match the practice you're purchasing. Bottom line. I mean, of course, anything's possible, but it's just going to be a lot harder if you're trying to change something major like that.
And you might want a 5-year plan. It's like, if you're a big implant person and there's nothing happening in there, it doesn't mean that you can't come in and start, someone, you have to extract a tooth, you educate them, you can change it. It's just not, if all you want to do is implants, that's not going to happen overnight. You've got a bread and butter practice, and that goes for
anything. So procedures are one way. So folks, think about what you're comfortable with. Align that with the codes. Paula talked about getting a code book on the last episode. Code book. What's that called? What's the official name for that?
I mean, there's a few out there, but it's the CDT. It's the
CDT. Yeah.
2023 CDT.
Code book. Hashtag code book. Get a code book and find those procedures and then match them up with the reports. I've had situations where, Paula, how would you figure this out? I've had situations where the broker misrepresented the practice and they didn't know actually, and they sold it as a bread and butter, but really it was a full mouth. They were doing a lot of full mouth stuff. It's a lot of fixed stuff. How could you identify something like that? Because that's a major risk. When you buy a practice and it's slow, that's one thing. You should be prepared to buy a slow practice and do same day dentistry. But if you buy a practice that's doing all on fours, or maybe that's the bad example, but a lot of that kind of work, like, could you find that in the codes? Would you see that in the schedule?
Yeah, I think, because, it's kind of a 2-to-1 ratio, 2 fillings to 1 crown, or, there's all kinds of things out there like that. If all of a sudden you saw, 100 crowns to 1 filling or something, I mean, they're doing full mouth reconstruction. It's a prosthodontist. It's a pros office at this point, so I think if it's astronomical, I think just everyday dentist, it can be a little skewed, 2-to-1. That's just kind of a number out there. If it's 3-to-1, if it's 5-to-1, 5 fillings to every 1 crown, they're probably a little conservative. If it's 2 crowns to every 1 filling, maybe, I don't know, I'd have to reevaluate that. I'd have to see. I've never played with that. But
is that what they say? We
say.
Talked about they last time.
But if all of a sudden you're seeing, I'm not going to cuss, an astronomical amount of crowns, they're probably doing some full mouth reconstruction. Okay. If you see veneers have a totally different code, so you could tell if it's a lot of cosmetic dentistry. So there's just like ortho, if there's a lot of ortho codes, then, they're doing a lot of ortho. So I think you can tell a lot by the codes for sure.
You just read my mind. Let's go down the ortho track.
Okay.
Thank you for bringing it up. What is the code?
80/90.
80/90
for full, and 80/40 for limited.
Okay, folks.
80/80 for children.
80. Okay, now she's showing off. Ortho. Okay, pitfalls with ortho, and orthos. If you're listening, these are not your golden. Well, yeah. This is definitely something to think about. But GPs playing with the idea of ortho, or hell, even in ortho, Paula, it was kind of cute, folks. She said, we don't cuss. We cuss on this show, don't we? Sorry, it happened. So
we do.
If you feel like running one, just go with it. We call them passion words on the show, passion, and you have a lot of passion with ortho. If it's something you want to incorporate, that's an opportunity. But go look under that code and see how many they're doing. I think, Paula, if my memory serves, did you inherit a lot of ortho cases that were prepaid for? Let's talk about that.
I wouldn't say a lot. I definitely had some. I had a blessing because I had a young associate that came in and finished them all without any additional charge. So I had a unique situation of there were some unfinished and prepaid, and he did me a solid and did that. The seller himself did not or care. But the associate, because he was the one in there and doing them, he was so passionate that he wanted to personally see those through.
Can you walk the audience through that? Like, I'm tracking you, but what's the risk there for buyers buying existing ortho cases, with the payments, financial arrangements and all that good stuff?
Yeah. You would definitely want to have something in place. Either the buyer's coming in and finishing those cases, which is tough, right? So some of us keep the seller, excuse me. Some of us keep the seller on because they got a great name. They've been with the practice forever and it helps with the transition. And then other times it's easier if the seller's gone. It just depends on the situation, right? So if the seller is going to stay on and they're the one that started the case, you just need to identify those and make sure that those are very defined in the purchase and sell agreement, so that you don't get into those. Because if you're taking those over and the patient either has paid in full, right, now you're owed some money because you got to finish these cases out, or they're making payments. You don't have that same relationship with those patients. So you just want to make sure that whatever you do in that purchase and sell, that you very much define the situation that you're in and how that's going to finish out for each of those patients.
So there's the money part, what's collected, what's outstanding, what work is to be done. That's that. Then there's the question of how to incorporate Invisalign gotta quit saying Invisalign, but someone like Invisalign.
Well, I mean, mine were brackets and wires. So
oh wow.
I needed a full-blown, bracket and wire person. So it would have been impossible to find, just an average associate off the street. So I think you're right, though. You got to look at the money aspect, and you also have to look at the treatment, and you have to look at the philosophy, right? So, for instance, in this case, this associate had started this, poor kid's canines were up in his eyeballs and was pulling them down. Like, what if I hadn't done my due diligence, like, there's no way I would have had to send him to an orthodontist, refund some money, there would have been kinds of things. So you just got to be careful when buying ortho. You got to be either really comfortable with it, or the person has to stay on and do it, or we've got to really define what's happening in the situation.
And I guess we're making this about ortho.
Sorry.
No, that was me, but mainly because of the financial arrangements. That really goes for really big cases in general. I think if you're buying a practice where there's a seller who's getting into dentistry and being super nerdy and doing big things, like, it might make sense to keep them on and finish out that work in progress, as we call it.
I mean, even if they just dropped an implant a couple months ago.
Yeah. And there's
the risk
warranty
of that implant failing.
Yeah.
It could happen. So you've got to have some liability around that, right?
Yeah.
What you're getting at?
Yeah, well, liability, financial arrangements, how much money was collected, how much work is to be done. So ortho exaggerates that idea, but like, you're right, implants, any major cases that might have a longer quote unquote warranty, they either need to get watched, you need to ask how much money was collected up front, is there any more work that needs to be done, can you do that? So, I'm not trying to scare the shit out of you guys, but this stuff really does need to be thought of.
Yeah.
I mean, dentists come to me all the time. Listen, you guys are super smart. You can figure this stuff out. Most of the time it's fine. These are the horror stories. This is how you eliminate the horror story, is looking at this kind of stuff. So,
so I think it boils down to just those big cases, like you just said, Michael. It's just, coming up with a plan around it, a financial plan. If you're comfortable as a new dentist coming in and buying a practice, if an implant fails or you need to do something, are you comfortable doing it? If you're not, what's plan B? Because if you're comfortable, you just hold some money back. You just say, if they've collected it all, some of that has to go with you to be able to warranty that investment. Mm-hmm. If you're not comfortable, then it's the other plan. Can the seller be responsible for that? And then what does that look like?
Yeah. Beautiful.
Right. I mean,
that's exactly right. Yeah. It's perfect. Your attorneys help you, solidify all of these little nuances. And we had Robert Montgomery, another legend in the industry, talk about the purchase and sale. We didn't get that deep, but a guy like him can figure all that out and really protect you. That's what your attorney's for, by the way. Everybody thinks, I feel like people, sorry, I'm going to go down a path here. It's nothing to do with clinical due diligence, but that's why you have a team. But understanding the roles of each person on the team is really, really key. Your attorney's the one writing the paragraph in the contract that specifically says, hey, any work in progress is dealt with this way, and any warranties are dealt this way. And so that's what your attorney's for, obviously. Anything, I'm going to kind of shift this a little bit towards team now. I know that's not clinical, but we didn't cover any transitional issues with team with Art Wiederman. We really just focused on numbers. So Paula, we're kind of experts in the team world. And I know you dealt with some stuff in the team department. So it's really, this
I don't know
is,
what you're talking about.
I know you don't, but I will have fun reminding you.
I'm kidding.
It kind of goes again towards this question. What are some of the biggest pitfalls that you had when you purchased your practice? And again, leading the witness slightly because I was so close to it, but there was a lot of team issues. And I think team in general is something that our clients deal with. Doesn't necessarily have to be yours, Paula, but maybe all of the deals that we've been a part of with team. Can you think of some scenarios of things that we can get ahead of before the purchase goes down?
I guess asking
For those of you watching on YouTube, Paula's dog just made a guest appearance, which is a good moment to remind you that you should be subscribing to YouTube and watching our faces interact. And you can see Coda. Coda just popped up.
There's a little bit of Coda.
Hi, Coda. Yeah, team issues with transitions. I mean, I got to be honest, this is one of the biggest things.
Okay.
Yeah.
Well, I'm going to start with mine briefly because mine was probably the most unusual circumstance ever. What could I have done differently to know that when I walked in day one that there was actually no team? I don't know that I could have done anything different. You know, on the prospectus and what the broker gave to me and the dentist, selling dentist gave to me, there was an entire team with their wages. Mm-hmm. And then when I walked in, there was no one. I don't know. I guess I could have had a bigger voice in the moment, but you know, what was done was done. I think what we see mostly is just teams in shock, right? Mm-hmm. Teams upset, teams feeling that they instantly have a distrust.
Yeah.
There's something that went on behind their back. Nobody trusted them enough to tell them.
Yeah.
How could this happen? They're very afraid of what's to come.
But you've bought and sold. There's a reason why you don't tell team, and we've discussed this. It does protect everybody. In your situation, you had no team day one, and actually you were protected legally. You just had to execute that, and you didn't.
No. I was, and I was different because you know when I sold, I told the team too in advance.
Don't do that, folks.
I know. Don't do that. It was a different circumstance. I was lucky enough to have the buying doctor come in and work for a month. You know, my circumstance was completely different. The reason we don't tell is because I'm a buyer, and if they get spooked, what happened to me is going to happen to you all. You know, they're going to come in and the team's going to be, without even giving the new owner a chance, they're going to jump ship, right? They're going to go look somewhere else. And that's why we don't tell. Is I want to protect the buyer and make sure that they have a chance to meet you and know that they're going to be in good hands, and that I, as the seller, handpicked you to buy practice because our philosophy is aligned, and I knew you were going to take good care of my team. So we want a chance to tell the team that. And if you just tell them before they meet you, they have no idea, and you know, we're left to make up all kinds of things in our head. So I think, you know, bringing the buyer in the day of, and they get to meet you, they get to be introduced to you, you get a chance to talk to them a little bit, has seemed to work out really well in most situations.
Let me flip your brain to a different direction.
Okay.
And that is change. Every young buyer went through school, modern day dentistry, and they're buying a practice where the seller might not be so modern. And so one of the things that buyers want to do is make change.
Right.
And how hard that can be for team. Do you have any suggestions around how to implement team with a newer team to you, but an older team to the practice?
So I think what you're saying is just, well, I mean, first of all, we typically suggest don't make a ton of change in the first 6 months. You know, just you are new, you know, you're there to learn. Their way might be, they may have some amazing ways in a lot of ways that might actually teach you. I guess I shouldn't say all buyers are brand new, because, you know, buyers come in all shapes and sizes, but we mostly deal with, you know, babies straight out of, you know, dental school, or, you know, been being an associate for a couple years and they're ready to buy. But I know that there are some more seasoned doctors that definitely become buyers that, you know, probably have a little bit more experience underneath their belt. But let's talk about the majority that we're talking about. So you have a lot to learn, right? You get in there and, you know, not only do you need to earn their trust, but there's a lot of experience in that room. And I think sitting back and listening to them for 6 months doesn't hurt. This is your vision, this is your baby, but you get to make those changes. You're going to own it for the next, 20,
30
50
years.
You know, who knows, 50 years.
Hopefully not 50, folks.
I've seen a lot own that long.
Invest your money, folks. Invest your money. No, Paul, you hit it. And that is that the team has to trust you first. And we've had some clients that the team never trusted the doctor right out of the gate. And it was difficult to earn that back. And that's a challenge in itself. So you do got to win their trust, because they're selling treatment for you, by the way. You're not the best salesperson, God's gift to sales. So you do need that team. So trust is huge. And I'm glad you brought that up. I also think, like, if you're buying that smaller practice, kind of like you did, the startup, the fixer upper, it's probably more prone to change than if you bought a practice doing $1 million or more, and it's kind of, dare I say, a well-oiled machine. Is there a different strategy around change of those two profiles of practices in your mind?
Well, I think sometimes a broken practice, you do have to change a little quicker, right? If it's failing, you know, it's already not doing what it needs to be doing. So how much more harm can you do, you know?
Yeah.
So I think if it's a well-oiled machine, definitely you come in, you just go with the flow, you earn trust, you learn from what they're doing right. And then, you know, you may even alter your vision and your changes you want to make based on what they're doing. Like, hey, I actually like that better, or hey, I like that, let me tweak it a little bit. So I think there's a lot of sitting back when you come into something where, like I came into, where you're living same day dentistry, just do it. Yeah. Just do what you want to do, because there's nothing that you can probably do to hurt it, and you can only help it. You know, I think some of the biggest things that I find, you know, pre-buying is just, for me, you know, and you mentioned earlier, don't promote us, and I'm not going to. It's just know that the broker, you know, as great as brokers are and as honest as brokers are, they're representing the seller, right? So they're there to buy or to sell a practice. So as a buyer, you either get a buyer rep or you just really do your diligence. Just be careful, because, you know, you get advice from sometimes too many people, right? We have people who listen to a lot of podcasts, and there's different opinions on a lot of
Mike
things.
Dincio said.
Well, that one they need to listen to.
Yeah.
No, but
exactly.
I think that it can be pre-buy and after you buy. And I think the pre-buy is, you know, do your due diligence and know that, you know, you are representing yourself. So no matter what information you're given, you need to go in and do your due diligence, whatever that looks like, right?
Yeah.
I think talking to the seller, because I've seen, and I did this, you know, you get caught up with the broker and the lawyer and the contract, and all of a sudden there can be some distrust. So I think making sure that you talk to the seller at some point, right? Anybody you look in the eye and have a chance to have a conversation with, that's where the truth lies.
It's good advice.
Yeah. I think knowing you know it all, no matter how, you know, and I kind of said that earlier, being a perfectionist, you'll never know it all until you have the experience. You can probably think of any job you've had in your life. You can probably think of, you know, being a freshman versus being a senior in high school. You think you know it all, and then, you know, 4, 3, 4, 6, 10 years in, you're like, oh, okay. Even being a teenager, you think your parents are stupid, and then you realize you don't know it all, right? So that, and I think just, listening to too many people, what I've seen once they buy to watch out for is the changing too quickly. And that's what brought this whole thing up, right? Changing too quickly. And again, you listen to either bad advice, or you're given really good advice and you don't take it because you're a bit arrogant because you have worked as an associate in a practice for many, many years. And then the last thing I think is just people who are drowning forget to reach out, right?
Mm-hmm.
It's, you think you're supposed to know it.
Yeah.
And you're afraid to ask for help because, you're a dentist. That's not something you should know how to dental practice.
It's funny that you say that, because just because you're a dentist doesn't mean you're the best leader or business owner ever made. We have a lot of clients that won't admit to themselves or to the team that they don't know something, and that's dangerous. Well, I'm not saying we have now, but we've had clients that walked into practices and they didn't want to look, I guess, weak or incompetent. It was maybe an insecurity. I will tell you, the most confident people can say, you know what? I don't know. I'm going to find that out and get back to you. That I think that instills your team. Your team knows that you're not feeding them a line of bullshit, or that you're just trying to dance in traffic. I hate that word or that phrase, dance in traffic. It's okay not to know something. Just say, hey, I got a team of advisors. I don't know. I'm a brand new owner. I'll find that out. We'll do the right thing. That's okay. I think your team needs to hear that. But there also are some things that you need to do to get prepared walking into that, and having an HR manual is great to have it. It enforces stability with the team. And we're going to get into that actually. HR for Health is our group that we're going to get into some of that later on in the season. So, but anyways, I digress. The reality is too much change versus not so much change, and I think it just depends, is the overarching idea there. Any last thoughts, Paula, or comments about just the fit of a dentist buying a practice clinically, even leadership wise? It's so important. But any last thoughts that you may have to add before we shut this bad boy down?
I would just say, read your purchase and sell. Don't rely on somebody. I would say, take inventory of the big things in the practice. When you go in and do your due diligence of all the numbers, and you're evaluating the technology and all the different things in the practice, those really big, important things that you're going to need, take pictures, take inventory, compare that to your purchase and sell. There's a clause on there that's exclusion and inclusion, right? So if someone writes all the things that are included and they leave out things that aren't included, but they don't exclude them, it can be somewhat of a battle. So just, if there's something, the autoclave, the lasers, the intraoral cameras, just take note of all those and just make sure that the inventory is there on your purchase and sell. I think if there's things like membership plans, things where they've already pre-collected money on deals that have, marketing that's gone out there of specials, anything that might affect you. And again, it's totally fine. Go with it. That's marketing for you. It's advertising. I think you just need to know what you're getting yourself into. If they have a membership plan that they're prepaying for, and then you have to honor that membership plan, it can be, a little expensive. So just make sure that there's things in regards to taking the team from you, memberships, marketing that's out there. Trying to think, what else? One other thing that I wanted to say, it was really important that I wish I would have known is, how are you credentialed, right? So when I came in, I just credentialed my own doctor. I'm like, to heck with it. Like, let's just get your name on a piece of paper and get you in there. And lo and behold, I like had the worst fee bracket ever in all of America. And I had to go through 2 years of this, right? Because I just didn't know. So I think making sure that, you know, your fee schedule is one thing, but your insurance fee schedules is what's more important. How you're credentialed, how you are in network with each of these providers, which only really someone with a lot of experience can do that for you. It's really hard, you know. Susie Q, I'll just call her that because I called her that before, up front, might not know how to do that. So don't just trust someone saying, sure, I've done that before. Yeah. There's a process. And then the last thing I would say is, you know, you inherit ARs and credit, you inherit a lot of financial stuff, right, in your practice, a lot of outstanding stuff. And I would say the best thing that I did was get a third-party biller in there that cleaned everything up, looked at my credits, looked at where my ARs are, just got me in order. And if Susie Q up front's going to take it over, that's totally fine. I just want to make sure that what I bought and where I'm at now is, I know, you know, because even in a due diligence prior to buying, that's hard to know. So when I buy it, I want to make sure that there's somebody in there that can tell me where we are, what we need to do, how we need to make this beautiful. And then if you want to hand it back to the front office, that's great. That would just be my couple pieces of advice from being an owner and not learning the hard way.
Yeah, there was a lot there, folks. I rewind that last 2 minutes, 3 minutes, and listen to that again. I challenge you, because each one of those caused Paula specifically a lot of heartburn, and you learned a lot from that. But
absolutely,
if there's anything to really highlight with all of that, is not all of none of this would really put anybody under. That's the great thing about dentistry is it's such a good business. Even one misread during the due diligence process is not going to totally wreck you. It's almost a death by paper cuts, I suppose, if that's even a real thing. But catastrophes are, you know, where we started with this 2-part series, and that's making sure you don't run this thing down from a production perspective. So Paula, thank you so much for spending the time with me. You know, I think a lot about you, obviously, as a partner in this business. And folks, you can get a hold of Paula. I'll put some things down in the description below. Reach out. She's an open book. You can set up a consult, have this discussion with her and her experience. She also sold, so she's been on both sides. A lot of experience here, clinically and professionally. So don't hold back. Reach out. So thanks again, Paula, for being on the show.
Thanks for having me on.
Okay, talk to you soon.
Okay.
Probably in like a minute. Bye.
Okay.
Tune in next time for another truth-filled episode of Acquisition Unscripted. We want to hear from you. Interact with your host, Michael Dencio. Follow us on Facebook, Instagram, and YouTube. Comment and subscribe.